Neurotic disorder or neurosis. When a person is getting stress, he will have some type of anxiety. Anxiety is a normal response. But some people, when they get stress, they will show excessive or prolonged emotional reaction to stress. That is what we call neurotic disorder. In neurotic disorder, patient will show excessive or prolonged or inappropriate emotional reaction to any given stress. Neurosis is different from psychosis. We can say psychosis is a severe form of a psychological disorder, but neurosis is not that much severe like psychosis. Neurotic patients or neurosis patient is normal in all except in some case like patient will have some disturbance in consciousness memory. In other things patient will be like normal, and patient will not have delusion and hallucination. Neurotic disorder patient will not have any delusion or hallucination. So as I told you, neurotic disorder means when the patient show excessive or emotional reaction to stress, it is called neurotic disorder. There are different classifications for neurotic disorder: phobic anxiety disorder, generalized anxiety disorder, panic disorder, obsessive compulsive disorder, reaction to severe stress and adjustment disorder, dissociative disorder, somatoform disorder. Let's see all these concepts in detail. Phobic anxiety disorder or phobia. A phobia is an unreasonable fear of a specific object, activity, or situation. Phobia means patient feels unreasonable fear of a specific object, activity, or situation. If you ask the patient, he cannot explain you why he feels that fear. Even he doesn't know why he feels fear of a specific object or activity. That is called phobic anxiety disorder or phobia. There are different types of phobia: simple phobia or specific phobia. In this case, patient feels irrational fear towards a specific object or stimulus. Example, acrophobia. In acrophobia, patient will have fear of heights. Algophobia, fear of pain. Zoophobia, fear of animals. Hematophobia, fear of the sight of blood. Claustrophobia, fear of closed space. Gamophobia, fear of marriage. The second type of phobia is social phobia. In this social phobia, patient will have irrational fear of performing activities in the presence of other people or interacting with others. Some people, they will have problem in interacting with others or performing or speaking in an open space. This is called social phobia. Agoraphobia. Agoraphobia means irrational fear of being in place away from familiar setting like home, etc. Like these people, when they go away from their home or if they are in a crowd, they will have a lot of fear and anxiety. That is called agoraphobia. These are the different types of phobia. Treatment for this phobic anxiety disorder is benzodiazepines, antidepressants, then behavior therapy. Behavior therapy include flooding, systematic desensitization, exposure and response prevention, relaxation techniques, cognitive therapy and psychotherapy. Regarding these treatment, we will discuss detailing in other classes. The second disorder is generalized anxiety disorder, which means unrealistic anxiety about everyday worries that persist over time. In this case, the patient will have worries and anxiety all the time. The patient will have this type of anxiety. He always think about his everyday worries and he worries about his problems. Even though there will not be any proper worries or there will not be any a problem for the patient, still he feels worries or he still feels anxiety. That is called generalized anxiety disorder. Symptoms: if you see the symptoms, patient will have psychological disturbance. At the same time, patient will have physical disturbance. Like patient will have worrying thoughts and apprehension. That is psychological problems. At the same time, patient will complain physical problems like loose motions, overbreathing, palpitations, discomfort in chest, urgent micturition, failure of erection, dizziness, headache, insomnia, and other sleeping problems. This is called generalized anxiety disorder. Panic disorder. Panic disorder means sudden attacks of anxiety in which physical symptoms predominate and are accompanied by a fear of serious consequences such as heart attack, which means that patient feels sudden attacks of anxiety. Patient may be normal, he may be sitting somewhere normal. Suddenly he feels sudden attack of anxiety and he shows lot of physical symptoms and he will act like that he is going to die, or he will act like he is having a heart attack, something like that. In symptoms you can see shortness of breath, choking, chest discomfort, palpitation, sweating, dizziness, abdominal discomfort, flush, fear of dying. All these symptoms patient will show. So in this case it is panic. Suddenly it is coming, he may be normal, suddenly he will tell that he feels palpitation or he feel breathing difficulty, and he will show in such a way that he is going to die. That is panic disorder. Treatment for this: benzodiazepines, antidepressants, beta blockers. Behavioral therapies include biofeedback, hyperventilation control. Other psychological therapies, which include Jacobson progressive muscle relaxation technique, yoga, meditation, self-hypnosis, and supportive psychotherapy. Regarding these psychological therapies, we will discuss in the other class. The third one is obsessive compulsive disorder. Obsessive compulsive disorder include obsession and compulsion. Obsession means intrusive thoughts and ideas that produce discomfort, anxiety, fear, etc. Which means patient will have thoughts and ideas which is coming again and again to his mind. Example, he is thinking that his hand is not clean. This thought is coming to his mind again and again. When he thinks about that, he will get anxiety or discomfort. This is called obsession. Another example is patient is thinking that his room is not locked. This thought is coming to his mind, and this thought is coming again and again that his room is not locked. So when he thinks about this, he feels anxiety and discomfort. This is called obsession. Next is compulsion. Compulsion means repetitive behaviors. He is doing repetitively same action, same behavior. Example, when he thinks that his room is not closed, he is going and checking the room lock. He is going and checking the door. He is going checking the door again and again. Why he is doing means when he is doing like that, he feels reduce in his anxiety. The anxiety is reducing, so that's why he is doing like that. So in obsession, he thinks that the room is not closed or his hand is not clean. This produces anxiety. To prevent this anxiety, he will go and lock the door or he will go and wash his hands. So the anxiety will be reduced. But in what is happening here, again he will have the same thinking and again he will do the same things. So this is called obsessive and compulsive disorder. Obsessive compulsive disorder are different type. One is OCD with the predominantly obsession. In this case, you can see obsessions, more obsession. OCD with the predominantly compulsion. In this thing, you can see more compulsive activity. Here, in obsession, there will be more thoughts are coming for the patient. But in OCD with the compulsion, patient will give more importance for the activities. He will go and wash the hand, or he will go and check his door again and again. He will give importance for the action. And OCD with mixed obsession and compulsion. In this thing, both you can see both thoughts problem and the activity. He will do both things. That is obsession and compulsion. In the clinical feature, you can see sometimes patient will have this type of thoughts, sometimes images will come to his mind, sometimes patient will have doubts. These doubts come again and again, whether I locked my room, whether I locked my room. These doubts will come again and again. Sometimes other type of impulses, and some type of he will do same activities again and again. So these are the clinical features of obsessional and compulsive disorder. Treatment: antidepressant, anxiolytics. In behavior therapy, we can do exposure and response prevention. Thought stoppage. Thought stoppage means we will tell the patient to think about that obsessional thought. Like if he is thinking that he will tell the patient to think that thought which is giving stress for the patient. Like we will tell the patient to think that if he is having the problem of washing his hands, will tell the patient that think that your hand is not clean. Then the patient will think automatically in his mind, a stress will produce or anxiety will come, and he will tell that I want to go, and he is getting the uh, thought to go and wash his hands. So what we will tell, we will first tell the patient to think about that thought. If it is if it is like his hand is not clean, we will tell the patient to think about that. Then suddenly we will give the order, stop that thought, stop that thought. Then we will train the patient to stop that thought, that worrying thought. We will train the patient. That is called thought stoppage. Then desensitization, awareness conditioning. These are the other treatment for obsessive compulsive disorder. Next one is reaction to stress and adjustment disorder. In this thing, the main problem is post-traumatic stress disorder, PTSD, post-traumatic stress disorder. As the name indicates, normally after a traumatic event like flood, earthquake, war, rape, physical assault, the patient again will experience or re-experience that event, or re-experience the stressful event that happened in the past. In the past, patient maybe had any stressful event like as I told, flood, earthquake, war, rape, etc. And after months, again the patient is getting the same experience. He is re-experiencing, and patient is getting stress. That is called post-traumatic stress disorder. Post-traumatic, after a stressful event, patient is getting stress by re-experiencing or by rethinking the same event. That is called post-traumatic stress disorder. Next is dissociative or conversion disorder. Dissociative or conversion disorder means when a person is getting stress or anxiety, sometimes patient will have disturbance in memory or consciousness or identity. This is called dissociative or conversion disorder. Means converting the problem, the stress is converting into other form. Example, the first one is dissociative amnesia. Dissociative amnesia means when a patient is getting a stress or after a stressful life event, maybe an accident or rape or whatever it is, after a stress, patient is forgetting important personal information, particularly related to that event, or patient cannot recall important personal information after stressful life event. Example, a lady, she had an accident. After accident, when we asked about her name, address, everything, she is forgetting that thing. That is called dissociative amnesia, because when she thinks about his past, she will get she will remember her stressful life event, she will remember her that accident, which will give her more anxiety. So her mind is forgetting that event along with the personal informations, other things also. Then dissociative fugue. Dissociative fugue means suddenly a person is traveling away from his home or workplace. Unexpected travel away from home or workplace. One day the person is traveling away from his home and going to some other place, and there he is assuming new identity. He is forgetting his name or other personal information, address, everything. He is becoming a new identity person, new identity. He is assuming new identity. He is telling his different name, and he is going some other place, because you see, when a person is getting stress, because of that stress this is happening. Because of that stress he doesn't know how to respond to that stress, so he is responding to that stress in an inappropriate way. Because of that he is going away from his home, then he is going somewhere, and he will stay somewhere. And we know a lot of cases when police is getting this type of people, and when they ask their name or address anything, he doesn't know his address or other informations. He will give some other address. After treatment, when the stress is relieved, then these persons will get back their memory. So that after treatment, when they will get their or they can remember their personal information, and they will come back to home. So this is called dissociative fugue. The dissociative stupor means patient will become mute and do not respond to stimulation, but he is aware about the surroundings. He is aware about the surroundings, but whatever you ask, he will not answer. He will sit like a mute person, and he will not respond. That is called dissociative stupor. Next is multiple personality disorder. We have seen this type of disorder, multiple personality disorder or dissociative identity disorder, in lot of films. What is happening in this? The person is dominated, or person will show two or more other personalities, and of these personalities only one will manifest at a time. Sometimes three personality. One may be normal personality, second may be a personality of a child, third may be a personality of an older person. And these three personalities doesn't know about the aware of the other personality. Example, the old man, he doesn't know that there is another personality like a child personality in this man. They don't know each other, and all these personalities will have different unique identity. They have different uh, mental functions. Everything will be different. Their knowledge level, everything will be different. In a lot of cases the mental activity will be higher. So multiple personality disorder means in a person we can see two or more personalities. That is multiple personality disorder. Trance and possession disorder means temporary loss of both the sense of personal identity and full awareness of the person's surroundings. Temporarily, for a time being, person will forget his surroundings, and he will assume, or he will forget his identity, what he is. He will forget everything, and he will for, forget everything for a temporarily, for a time being he will forget everything. You can see this type of problem in the case of temples, or sometimes we will tell that a ghost entered to his mind, or god entered to his mind, or spirit entered to his mind. Because when there will be a lot of prayer, or when the person is deeply involved in this prayer or that function, uh, religious function, suddenly he forgets everything, forget our personal surroundings, everything, and he start to act like sometimes spirit or god. He will talk like a spirit or god, something like that. So normally people will say, oh, because of the religious activity, the spirit has ended or god has ended. But the thing is that sudden he had lost his personality, and he forget about the personal surroundings. So that is called trance and possession disorder. Temporarily he forgets his name, his identity, and his surroundings. Dissociative motor disorders. In dissociative motor disorder, there will be motor disturbance like paralysis or abnormal movement. So in this case, after a stress or anxiety, patient will get paralysis, or patient will show abnormal movement of hand or leg, something like that. But when you do a physical examination, you can see everything is normal. When you do that physical examination, his uh, muscle tone, muscle reflex, bone, everything is normal, and doctor cannot explain why he gets this paralysis. But the case is that it is because of the motor disturbance, or because of the dissociative motor disorder, like his psychological problem. he is exhibiting in a as a motor disorder. This is called dissociative motor disorder. Dissociative convulsions. Dissociative convulsion means patient will have a convulsive movement or seizure will be there. It is otherwise called hysterical fits or pseudo seizure. It is not the normal seizure. It is a pseudo seizure because patient brain is not having any problem. It is only because of his anxiety or only because of the disturbance in his mind. So patient will show convulsive movement or fits or seizure, and there will be partial loss of consciousness, but it is called dissociative convulsions. It is not the normal seizure, it is pseudo seizure. Then dissociative sensory loss and anesthesia. In this case, what will happen? Patient will have sensory disturbance like hemianesthesia, blindness, deafness, and glove and stocking anesthesia, which means when you check his physical examination, everything will be normal, but patient will say that or patient will show that he is having hemianesthesia. When you touch his hand, he will tell he cannot feels that, or sometimes patient will tell he is blind now, he cannot see anything, he cannot hear anything, and sometimes patient will it's called glove and stocking anesthesia, which means when you check he will have when you check his wrist and ankle, he will tell he cannot feel the sensation, he cannot feel that. That is called glove and stocking, which means glove, the area where we wear the glove, there if you touch, the patient will not have any sensation. And in the leg, um, if you touch, he will angle, if you touch, he will tell I cannot feel that. That is called glove and stocking anesthesia. But when you do a physical examination or when you check other things, it will be normal. So the problem is in his mind. Then Ganser syndrome means, in this case, if you ask any questions, he will give approximate answer, not the correct answer, approximate answer. Like if you ask what is 3 plus 3, he will give answer 7, not 6. He will give answer near to that. So approximate answer 3 plus 3, he will give 7. He will not tell 12, he will tell 7. Means the actual answer is 6, but he will give 7. Near to that proper answer he will give. That is called Ganser syndrome, or whatever it is. If you ask any question, he will give approximate answer, but he will not give actual answer. The treatment is free association, hypnosis, abreaction therapy, supportive psychotherapy, behavior therapy, which include aversion therapy, and operant conditioning. The other disorder is somatoform disorder. Somatoform disorder is characterized by persistent worry or complaints regarding physical illness without any physical findings, which means that patient will always complain about physical problems, always complains about his physical problems, or always go and seek doctor, always take medicine, always they will do medical checkup, even though doctor will say that okay, you are normal, you don't have any problem, all the findings are normal, still the people say that no, I have some problem, I have some physical problem, I have some uh, problems on my health. They will always complain and always worry about their health. That is called somatoform disorder. There are different categories: somatization disorder, hypochondriasis, somatoform autonomic dysfunction, persistent somatoform pain disorder. Somatization disorder means he will complain or he will tell he is having chronic multiple somatic symptoms in the absence of physical disorder. Like when you check, he will be normal, everything will be normal. His medical, sorry, his blood test or X-ray, all investigations will be normal, but still he will tell he is having some chronic multiple somatic or body prop symptoms. That is somatization disorder. Hypochondriasis means he believe or he is having the fear or he is believing that he is having a serious disease, like he is having cancer, he is having AIDS, he is having some other serious heart problem. even though the doctor will tell that you are normal, still they believe that they are having some serious disease condition that is called hypochondriasis. Somatoform autonomic dysfunction means there will be patient will complain autonomic symptoms like autonomic symptoms means as you know the autonomic system is not under our control, like heart uh, heart rate or hiccup or other things which is not under our control. Still, what is called autonomic symptoms like palpitation, hiccup, hyperventilation, all these things which is not our control, it is autonomic under autonomic system. Still, they will complain these things like palpitation, hiccup, hyperventilation, irritable bowel syndrome. The patient will have hiccup again and again, continuous hiccup he will have, or he will have palpitations. So when you check other when you do other medical investigation, everything will be normal, but we don't know why the patient is getting hiccup and palpitation, etc. So this is called somatoform autonomic dysfunction, which means patient will give or complain lot of autonomic symptoms like palpitation, hiccup, etc. That is somatoform autonomic dysfunctions. Then persistent somatoform pain disorder means patient will tell always having pain, severe persistent pain. But when you check, there will not be any. When you do any medical investigation, everything will be normal. You cannot find any problem, any cause, but still patient will tell that he is having severe persistent pain, he is having pain. So that is called a somatoform disorder. As I told here, a patient always worry and complain regarding physical illness, even though the doctor is saying that you are normal, they won't believe. Somatization disorder, I told, they will tell multiple somatic symptoms, multiple complaints they will tell. And somatoform autonomic dysfunction, in this also they will tell complaints, but the complaints or the symptoms what they are telling, they are autonomic symptoms like palpitation, hiccup. Here in somatization disorder, they may say any complaint, a pain, any complaint they will tell, but in this disorder they will tell the complaints, autonomic symptoms, autonomic problem. They will give you autonomic symptoms like palpitation, hiccup, like all these symptoms which is coming under somatoform, under autonomic system. So these are the somatoform disorders. The treatment is antidepressant, benzodiazepine, supportive psychotherapy, and relaxation therapy. So once again, I will tell you, neurotic disorder or neurosis means it is a severe form of psychological disorder. Normally, when a person is getting anxiety or stress, he will behave in a normal way. The anxiety is a normal response. But some people, when they get stress or anxiety, they will respond in an inappropriate way. So that is what is called neurotic disorder. Neurotic disorder itself different types as per their clinical findings. So it include phobia, generalized anxiety, somatoform disorder, dissociative disorder, etc., etc. Actually, the treatment of almost all the disorders are same: antidepressant, benzodiazepines, and lot of psychotherapy and relaxation therapy. Regarding the therapies, we will discuss later. Hope you understand this topic. Thank you.